Hello friends, today we'll be discussing an important topic, arteriovenous fistulas. This is a topic that we usually tend to miss on and questions are asked, so I'll try to cover them up in a short video. Arteriovenous fistulas can be either congenital or they can be acquired, and this is the first sight of a question that which of these is more common, and the acquired fistulas are more common than the congenital ones. To understand the pathophysiology of an arteriovenous fistula, we'll have to understand what exactly is happening. So see, from an artery, blood is getting shunted directly into a vein, right? Now the vein is not used to the high pressure blood that is coming from the artery. So this causes certain changes in the vein. What happens is the vein wall gets thick, right? The vein gets dilated, it gets tortuous. Now all these changes combined, they can be called as arterialization of vein, because now the vein starts to resemble more like an artery because now it receives a high pressure, high flow blood directly from the arterial side. What this direct blood shunting does is, first of all, it brings in a lot of growth factors. So the increase in local growth factors, it causes a hypertrophy of the part involved. So this is basically referred to as local gigantism because of an increase in growth factors. Second thing, that since blood is directly shunted away from artery, there is a fall in the diastolic blood pressure. Combine this with the fact that now the left ventricle is receiving more venous input. So because of this, there is a left ventricular hypertrophy that leads to an increase in systolic blood pressure as well as an increase in heart rate. These two factors combined contribute to a wide pulse pressure. Note this as an important point, that patients with AV fistulas have wide pulse pressure, and now you know the reason why. Another thing to note is that I'll describe it using a figure. Suppose this is a limb and this is the site of an AV fistula, right? So you see that the arterial blood was coming over here, and now at the site there is an abnormal communication and it's directly shunted back to the vein, right? So two things happen as a result of this. The proximal site is gaining a lot of growth factors, so it's getting hypertrophied, right? You'll see a swelling, you'll see that the part is hypertrophied. Now the part just distal to it just lost its arterial supply. So this part now is actually ischemic, right? And this is prone to develop ulcers. Now if you palpate this region, this region of AV fistula, if you palpate this, you actually feel a thrill, right? And if you auscultate the same, you'll notice the presence of a brew, right? Now this brings us to an important point that can be asked as a question. Now suppose if we obstruct the arterial flow at this level, right? We are obstructing the arterial flow at this level, we are applying pressure to it. So what happens is that the thrill goes away, right? No flow, no thrill. Same is with a brew, right? And the features that we were seen earlier, the heart rate, it will fall, right? The swelling, it will reduce. The pulse pressure, it will get normal. So all this is very clear. So this actually is termed a sign. When you apply pressure and you see all the features getting normalized, this sign is called as Nicola-Denys sign, right? Nicola-Denys or Branham's sign. Very important point, can be a potential question. Nicola-Denys or Branham's sign is when the features of an AV fistula, all of them normalize when you apply pressure to occlude the artery proximal to the site of AV fistula, right? Having noted this, we should also remember that there is something called as a cirrhoid aneurysm. It's a bonus point. I'll cover this up along with. There is something called as a cirrhoid aneurysm. It's typically present on the scalp. It's an AV malformation. It's present in the scalp, and the most common artery involved is the superficial temporal artery, right? All of these are independent questions, so you should remember these two things. Superficial temporal artery is the most common involved artery. Right. Second thing, you should know about Klippel-Trenaunay syndrome, right? Klippel-Trenaunay syndrome. This syndrome is a triad of AV malformations. As a result of this, a local hypertrophy that we just saw. And third thing is that these patients have venous varicosity. And the reason of this is because they do not have a deep venous system. The deep venous system is absent. Just to clear out any confusion, do not confuse this with another syndrome that is known as Kazabak-Merritt syndrome. Kazabak-Merritt syndrome is one where you have a hemangioma, and this hemangioma traps platelets and causes thrombocytopenia, and it causes bleeding. So do not confuse this. This is a separate entity. Treatment of AV fistula, it's easy to understand that AV fistulas can be treated with embolization. You just embolize the shunt. And one more thing, that if you do not treat an AV fistula, these patients will land up in congestive cardiac failure. Why? Because of the increased pressure on the left ventricle. So this sums up all the important points. I hope you liked the video. If you did, do like and subscribe. I'll be back with more. Thank you.